My name is Dennis Hollister. I'm a firefighter paramedic of about 25 years. Started up in Gunnison, Colorado, then Denver General Paramedics. I currently work at West Metro Fire Rescue as my full-time gig. And then I do this teaching thing on the side. All Pro CPR is my business. And I do need to really fast throw down a disclaimer that while I work at West Metro Fire and it's not a secret or anything, I'm not here representing them in any way, shape, or form. I'm here representing the fire company. Okie dokie. I have been asked to throw together a quick little first aid, what you're most likely to see in your shop downstairs. So this is a very short, very confined first aid presentation, if you will. So that being said, when I do CPR and first aid and ACLS and whatnot, I follow national curriculums that I have to teach these subjects to give you a 2-year certification. So that's this disclaimer down here is I've cut a lot out. So this is just us talking and learning. This isn't any sort of first aid certification. Fair enough? Okay. Do you guys have any questions for me before I get going? Because I have not done what I built for you guys before, I don't know exactly how long it'll take. I understand we've got to leave around 10. I won't rush it because I want you guys to feel like you're getting what you get. She'll have a copy of it, so if you have to walk out and miss anything, obviously you can see it. But as far as that's concerned, I'm going to present it to the point that I feel like you get it. So if it's going a little slow for you, you got to go to class or you have something else going on, do your thing. She'll have it on tape. But we'll try to certainly keep it moving. Fair enough? Everybody know where the bathrooms are? Everybody know where the exits are? Fabulous. Off we go then. What first aid is I do, am I going to be right here? I will say that, again, since this was just built a couple days ago, I don't know the exact order of things, so if I'm reading slides or looking at slides, it's not that I don't know the stuff, I just want to make sure I stay on with what you're looking at. But I promise I do know the material. What first aid is, basically we're trying to get you guys through the first 5 to 10 minutes of an emergency or a perceived emergency. We're not treating your family for the flu, we're not treating heart attacks, we're just saying, hey, this is what bad looks like, this is it, and do I need to call an ambulance? Can I take care of this myself, or should I throw them in a car and send them to urgent care? Okay? That's kind of what our focus is just that first 5 to 10, what's my next decision? And it's either going to be go somewhere else or call me up, so we'll get you through that time until we get here. Okie doke. All right then. Protecting yourself. This is major. This is probably the most important part of this whole class. So please remember, all bodily fluids have got to be suspected to be carrying something you don't want. Okay? Body fluids, bad. Especially the blood. HIV, Hep B, Hep C are the big ones we worry about in blood. I do like people to understand that bloodborne pathogens, Hep B, Hep C, HIV, can't soak in through your skin. So you had a cut, you didn't have gloves nearby, say you got some blood on your hands, you wash your hands with an antimicrobial soap. If you don't have open sores on your hands, you didn't have what we consider an exposure. We don't have a raise the red flag, call my supervisor. If that cut was squirting and it splashed into your face, now we've got lots of soft and mushies that the blood can get into. So that becomes a rinse, 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 rinse like crazy, soap, soap, soap like crazy, and then you need to go to a supervisor and say, I have had an exposure to a bloodborne pathogen. Okay? If the blood gets into one of your soft and mushies, eyes, mouth, nose, or open sores, that becomes an exposure where we need to do follow-up. Okay? So rinse it like crazy, and then to a supervisor after you've rinsed for like 15 minutes. Fair enough? Okay. As far as somebody sneezing in your face and you might get the flu, that's not really this class. We're more worried about the blood stuff. Because yes, you can get diseases and germs from spit, from other bodily fluids. But our worry here is somebody's got a bleeding finger. What do I need to protect myself? Gloves is the best idea. If you have squirting blood or anything like that, you can also put eye protection on. Even your shop eye protection is better than nothing when dealing with, I mean, we use the same thing as you guys. The more of your face it covers, the better. I would even, if I had some sort of terrible, like took a hand off and an arterial bleed, which guys could happen. I've seen it happen in wood shops, in schools. So you get somebody squirting blood, I want as much as me covered as possible. So I go right into my shirt, put gloves on, put goggles on, and keep yourself protected from their bodily fluids, okay? And if we ever have squirting blood, I hope we don't, we just almost kind of assume an exposure there and make sure we do some follow-up on whether it got anything. Fair enough? All right. Exposure control plan, I'll bet we don't have. That's kind of more medical facilities, daycares and whatnot where we have bodily fluids a lot. But an exposure control plan, throw it in there in case you have it. But it's basically like whoever you're the shop supervisor, I'll make you the supervisor right now. She gets an exposure, comes to you and says, what are we supposed to do? An exposure control plan is, let's not try to figure all this out while we're all stressed out. Let's write it down ahead of time and say, okay, here's the workman's comp number. Dennis said we need to rinse like crazy. Let's make sure we do that. And it tells the steps that you need to go through so that should something bad happen, instead of be like, does anybody remember? Grab the book and say step 1, step 2, step 3. Okay? Just a thought. All right, personal protective equipment, or PPE. I kind of already talked about it, but gloves, eyes are the main thing. Face, if it's splashing, if you can get your face behind something, that's great. This is usually going to be the main thing that you would have to deal with a cut or something. You have a first aid kit downstairs right above the sink, and it has some gloves in it. This rubber or latex or whatever this is. Did I go away from where you want me to be? I'm sorry. I'm going to keep running away from that thing too. These are in the first aid kit. They're in a little box that looks exactly like all the other boxes. If I were to be honest with you, I would take them out of the box and plop them on top, because if there's something you want the fastest, It's your protection. So I would just have these sitting just like that, because I opened that first aid kit and it's very organized. It looks awesome, but you got to read every box before you find which one has those little gloves in it. And this you want fast if somebody's bleeding in front of you. So possibly throw those just where you can see them. And then the other thing is this stuff breaks down. So if that first aid kit isn't gone through somebody annually, by somebody annually, might be a good idea to switch these out for a quarter and have a fresh set once a year or so. Okay? All right. Putting these, oh look, there it is. Putting these things on. What you need, how can I help?
It's pen.
So, a quick hit on how to put these on. Putting them on isn't as important as how you take them on. Once you get them on, don't get all anxious and excited and rip them. They will rip, but get them on nice and easy. Now, once you help somebody, we assume every surface of these gloves is dirty, so I don't want to touch my skin with these gloves. So the way we pull them off is grab palm of one hand with dirty to dirty. All surfaces are considered dirty. Pull it inside out slowly, and now this hand is clean, and I got to get this glove off, so I go under the cuff to the clean part and roll it inside out, and then you have your nasties there and throw it away. Okay? Questions about taking gloves off, putting them on? Biggest thing I can tell you on the gloves is maybe pull them out of that box and refresh them every once in a while. Okay, doke. EMS is Emergency Medical Services, also known as 911, also known as the fire department. I think Golden Fire has separate ambulance service. I'm not completely positive how they run it, but I believe they have a private ambulance service that comes with them. Throughout today, I will say this is a case where you would want to call me right away. Please don't do what has happened to me in the past, and now I have to say this. When I say call me throughout the class, don't call Theron and say, hey, we need Dennis's number. Call me means 911 throughout the rest of the day, okay? Call your 911 services. All right, when do I need to call? Immediate life threats, hopefully that will kind of be a little bit more clear what that might be by the end of the day. Significant mechanism of injury. If you're looking at a finger that's cut and you hold pressure and you're like, okay, that's not that big a deal, I don't necessarily need to come. Give them a ride to get some stitches. You take a hand off, I need to come. I should be the first phone call, get there going quick. Pale and sweaty is a bad thing. Pale and sweaty is kind of our window to the soul. When I walk into somebody's house and they have no color or they're sweating, that's the body's way of showing me that systems are starting to shut down. So anytime you have somebody that's getting real pale or real sweaty after an accident, or diabetics get that way, or somebody's having chest pain and they're pale and sweaty, that should be a 911 right away, okay? Pale and sweaty is always something that should be like, why are we pale and sweaty? Well, they just ran a marathon. Okay, now pale and sweaty is expected. But if you have this for some reason you're not sure why, or with an accident, or with bleeding, 911 should be called on pale, sweaty people after an accident, okay? One thing that I can tell you that is not necessarily any life-threatening thing, but still probably worth a call, is some people don't respond so well to the sight of broken bones or to the sight of blood, okay? And what they'll do is, it's called vagal. I don't know if anybody's familiar with the vagus nerve, but it gets stimulated, it slows the heart down, and that can make you pale and sweaty and then pass out. So, you got a cut that you're dealing with and you feel yourself starting to get lightheaded, you're vagaling, you need to lay down before I have to deal with both of you, okay? Because if you lay down, that gets the blood flow to the brain, and that way I don't have two people to treat when I get there.
But like, let's say it's the patient who has a cut
And
it's
they
them,
vagal.
and they're vaguling.
That's what we see more often,
Yeah.
is I look down at my knee that's going a new direction, which is one of the times I vagal in my life. I'm like, that's bad. And then I felt that everything's getting black. I laid down, blood flow goes easier to the brain, and we're all happy. Okay, so if you have somebody that gets hurt and they're vagaling, you see that pale, sweaty, or you see them starting to do this thing a little bit, they're gonna go. That's their body telling them. So lay them down quickly before we have to deal with the head injury they get from falling to the ground.
But then, if it's a minor cut, we don't need to do 911 then.
No, not if it's a clear
Okay.
vagal. I really don't think so. What I, on the record, officially would have to say is something else could be going on. Pale, sweaty can be a sign of a life-threatening emergency, so it's always safest to see. But if you call me on that, this kid's got a cut, he looked at it and he vagaled, I'm going to keep him laying down until he feels better, and I'm going to have to sign a refusal and say, we're out of here. Okay, so if you clearly have a reason for why they feel like they're passing out, i.e. I saw blood and I don't like blood, they don't necessarily need to come on that one. Okay, but if they actually pass out from it, we need to make sure they didn't hurt their neck, their head, things like that. Fair enough? Best thing you can do on somebody that vagals, and I will be honest, I will just tell you from my experience, it's teenage girls, so I don't. They seem to vagal a lot. So if you have one in the shop and you see her starting to get that woo, lay her down or him down. It certainly can go both ways, but be aware of it because that's a very common thing that we see is vagaling. Okay? Alrighty. Severity of a person's condition is uncertain. This is a very blanket statement, but I stand by it. If you have a cut and you are not sure how bad it is and if help needs to be called, that should be your answer, that help needs to be called. Okay? Never go outside of your decisions, especially with my kids that I'm paying to come to school here a lot. If you're not sure how to handle it, call somebody that is sure how to handle it. All right? You get a kid that cuts himself in class, you look at it, you're like, yep, you need stitches, and tape it up and all's cool. You're done with that. Take him somewhere to get stitches. You've never seen fatty tissue underneath skin before, and you're like, I don't like this at all. If it's outside of your comfort zone, that should become a 911 call for you. At least get somebody that's more comfortable with it, okay?
Do you know if there are facilities on campus like the clinic that can help with some of this stuff?
I would be super surprised if you had a clinic that can do stitches.
Okay.
They would help butterfly, and they could probably, I would think, help determine whether further help is needed. But urgent cares, primary cares are usually the first level where we see stitching actually possible. That would be worth a call to your clinic, but I don't know how you guys are staffed there and what equipment they have. A fabulous question. Okay. Does that make sense for everybody? Stay within what you're comfortable with. If you're looking at somebody that's maybe vagaling and you're like, man, he looks like, ooh, I don't feel good about this, call 911. We don't charge for coming. We charge once we get them in the back of the ambulance and take them. And we don't get commission. So I'm not going to try to talk anybody into my bus unless they really should go with me. Okay? Good on that? Everybody fair enough? Off we go, off we go. Okay, compression only CPR. I did bring a dummy along, and if anybody wants to play when we're done, not myself, I mean a mannequin, I guess I should call it. If anybody wants to play with hands-on CPR, I can teach you to recognize when CPR is needed, and the first steps to do until I get there, I can teach you that in about 2 minutes. So if anybody wants to hang out after, remind me, and we'll play with recognizing death and what to do until CPR, until ambulance comes. Yes, ma'am?
Sorry, another question. When you call 911, often you get the ambulance and the fire truck
Yep,
and
almost
the police
always.
and all that kind
Yep.
of stuff. And that always seems like a huge deal for when you're unsure about something. And that's one of my decision factors.
Let me make you feel better about that.
Right. Yeah.
You call me, I pad my numbers, I get more money to buy pretty trucks. So don't worry about that. I have a lot of opinions about how we do things, but don't worry about getting too many
That shouldn't
people.
be
It
part
just
of
makes
the
us
thing.
happy because now we ran 10 calls last set instead of just 4, and now
That's
we look
helpful.
more important.
That's good to know.
The vast majority of things we go on, we don't need to go on.
Okay.
But it gets us out of the firehouse, and we can pause The Walking Dead and get back to it when we get back. So you go right ahead and call.
Alrighty.
Okie doke. Yes, you get overkill for a lot of stuff, and that's how we roll. Okie doke. We are working on systems called priority dispatch, where if you're going, he's just got a cut finger, I'm not sure, we can now sometimes send just an ambulance, non-emergent. That's what our system is working on. I don't know if your system is using priority dispatch.
Okay, very good.
Okay?
That's helpful too.
All right. Recovery position. If you ever have anybody pass out or you're syncope, you're vagal or something like that, laying down is always good. And if they're unconscious, on their side is even better. Sick people tend to vomit. People that vagal will often vomit. So if we get them on their side, the emesis, the vomit, will go out instead of getting into the lungs and getting them aspiration pneumonia, which is a bad thing.
the floor down there is kind of gross.
Not my concern right now.
I know, is there anything we should do to kind of, like, 'cause that again would be in my head before I put a student on the floor lying down, I'd go,
You can take your
"Oh."
puffy coat off and put it under her head if you
Okay,
want
there you
to.
go, thank you.
But honestly, no, that's the
Okay.
last of my worries right now. We're not gonna sit there and hold them up if they're passing out, because then we're risking hurting our back and dropping them. So they're
Yeah.
gonna go to ground, that's where they're gonna go.
Okay.
Okay? We'll wash their clothes. I kind of talked about the skin already. Pale, sweaty is bad. Pale, cool, and sweaty is even worse. These are signs of bad circulation. If you're not sure what a person's normal skin tone is, the palms should always be kind of a pinkish color. Inside the lip should always be kind of a pinkish color. And you can check color by just pushing on the skin and seeing that it returns to its color rather quickly. So if you have concerns about somebody being pale and sweaty, and let's say they're having heart pain or chest pain or something, and you're like, is this person sick or not? One thing that can lean you towards sick is a cap refill, where you push on the nail bed, it turns white. When you let go, she should go back to its normal color within 2 seconds. Slower than that is an issue. Where I use that on a daily basis is with my kids that have nausea, vomiting, diarrhea for 2 weeks. You're like, am I keeping up with the fluids or not? Push on their nail bed, and when you let go, if it doesn't go back within 2 seconds, we need to get them to a doctor. We use it with the elderly as well, as to see if they're hydrated enough, and they never are. They never are. If anybody takes care of old people or your family lives with you or anything, hydrate them, hydrate them, hydrate them. Not enough water is the number one problem our elderly have, for sure. Can you tell I'm trying to get 4 hours into an hour? All right. Somebody gets hurt, falls, cuts themselves. They say, okay, look for dots. This is a nice mnemonic that you can remember for what to look for. I can make this even a little bit easier than a nice 4-letter mnemonic. Look for crap that ain't right. And if you got something that don't look right, maybe we need to investigate a little bit further. Okay, mechanism of injury is the idea of what happened to the person to possibly cause damage. In our world, it sounds like we're dealing with tools, and that stuff is usually going to be blood, so it'll be fairly obvious whether we have something we need to deal with or not. We're not talking about the rock climbing wall or anything like that, so we won't get into mechanisms a lot today. Controlling bleeding. All right, here's the guts of where we are. First, I am going to glove up, and then how do I control bleeding? I already told you this morning, you better get it.
Oh, should I answer?
Sure, go
Pressure.
for it. Push on it, okay? When you have accidents in your shop, this is the meat and potatoes of all of today, is push on the hole, plug the hole, okay? Our first aid slides, can I borrow your arm, ma'am? Is there any chance you would let me borrow that? She gets a cut across here. Let's say she does, my last cut with a power tool is I was reaching across the blade to get my piece of wood off the other side while I was holding this one in place. And the blade was off, but it's still moving a little bit, and I got a little reminder that I'm male and an idiot, and I got a little cut across here. But let's say you got that, and it was a deeper cut. We say pressure. Do you remember elevation? Anybody heard elevation before? Pressure points is where I cut off the blood flow at an artery. I don't want you guys to do any of that. What I want you to focus on is just direct pressure. So not necessarily this, because if you have a bleed right here, and I grab, where's the pressure? Where are you feeling right now?
It's underneath. It's
fingers
not on the
grip
wound.
in, and what you end up doing is actually releasing the pressure where you want. So when I say direct pressure, folks, what I want you to do is stand on them, get on top of it, and push it against a hard spot. And this is direct pressure. And if it was your finger, that's just squeeze. Anywhere that cut is, you're just going to cut off blood flow by pushing so hard it can't bleed anymore. And that is it. That's what we do with bleeding, and we do it until the bleeding stops. So if you do a little peeky peek and it's still bleeding, keep pressure on it.
So gloves, and don't worry about Band-Aids and gauze. Just the gloves and the...
Look, I brought all these great supplies. Yes, a Band-Aid would be great, but while you're looking in all the boxes that are labeled and they all look exactly the same,
right, exactly.
Push with just your gloves. And that's just fine. But I do want something clean and sterile ideally. But really, this is all going to get cleaned out, so sterile is the last thing
But
that I'm
washing
really worried
it,
about.
like in soap and water, that was the first thing I
No,
asked.
what you're going to get with that is more flow.
Yeah,
okay,
that's what I
especially if it's hot, because warm water brings flow and vasodilates and makes more bleeding. We can wash it with cold water after the bleeding is controlled, but if I got that finger cut, I glove up and I'm done. Okay? 10 minutes until it's done bleeding. and then we'll figure out whether it needs stitches or not. If you're looking at it and you're like, that's nasty, it needs stitches, and it's going somewhere to get cleaned up, I wouldn't even clean it up, because that water can start the bleeding back up again. So leave it a mess. Put the messy hand in a glove if you want to keep your BMW clean, and slide them, or Subaru or whatever. I don't know. You can glove them up once bleeding is controlled, and then you don't got to worry about the mess. But we do see a lot of starting the bleeding back up by trying to clean it up. Okay? If you're not going to a hospital, you're like, that doesn't need stitches, let's put some butterflies on it. Yeah, we'll want to clean that up.
And any quick hints on stitches, non-stitches on a finger cut?
Slow down, I got this.
Okay.
Yes, I do have a couple of hints, and we'll get there in 1 minute. Before we get to that, though, a couple of different kind of bleeds. Venous bleeding is what you most often see, or your bloody nose, that dark red blood that oozes. That's a venous bleed. That's one you're going to control with pressure. You'll always win on that one with pressure. If you ever have squirting, you've got artery, and call me. Okay? If you've got squirting blood, has anybody seen an arterial bleed? If I cut an artery, I'll paint the ceiling from here easily. I mean, it is under a lot of pressure. So if you ever like, oh, that's what he said, plug the hole and call me on an arterial bleed, because we're going to have to put really solid pressure on that all the way to the hospital, and that's a pain in the butt in the back of your car. So we're going to come on arterial bleeds. Okay? Plug the hole just the same. Fair enough? All right. I am holding my bandage on Leslie's arm, and I'm doing my peeky peek, and I note that this is filling up with blood. Now it's soaked. Next step is don't take that off, because if you're getting a clot forming and you pull that off, now we got to start from scratch. Okay, so leave that nasty blood-soaked thing on there as least as you want to. Put a fresh one on top of it, and now there's one more big thing you got to do. Any guesses?
Another one, and more pressure.
Push harder. That's what I need, okay? Because when I come on a cut and I take my little sterile 4x4 out and I put it on there, that's all I use the whole time. I never add bandages because I push hard enough. And if the hole is plugged, the bleeding will stop. So if you're filling it up, you're not pushing hard enough. Put another one on and push harder. Cool?
Can you push too hard?
No.
Okay.
If you get a tourniquet circumferential, you can push too hard, or if I'm grabbing you like this and going circumferential, I can cut off blood flow to your hand, but since we're just leaning on it, we're not cutting blood flow off to anything. Fair? Okay. Questions about those two kinds of blood and what to do with bleeding? Push, cover the hole. If you can't cover the hole, it might be two hands to cover the hole. And if you got something that's arterial or gushing blood, or let's say a very impressive cut with a saw, I generally don't talk about tourniquets, but I will in just a second, since you do have that chance that could happen. We'll get to tourniquet in just a minute. But as far as stitches, how to know if they need stitches or not, I'm not telling you this is the rules, but I'll give you some tips that I use. See that pink cottage cheese under there? That's fatty tissue. If you see fatty tissue, they're going to get cut, or stitched, glued, or stapled. Something's happening to that. So once I get bleeding controlled, if I can see tissue underneath their skin, they're probably going to get stitched up. Okay? Does an ambulance need to come for that cut with the bleeding controlled?
No, if the bleeding is controlled.
I'm not doing anything but charge you a lot to get you to the most expensive place to get stitches, which is an emergency room, which is all we can go to. So this person's way better to go to an urgent care or primary care in a private vehicle. It'll save tons. Now, Robin, you're the person dealing with this cut, and you see that fatty tissue, and you're like, ah! You might call me in to help you through that situation, okay? Calling me up is not a bill, and it doesn't mean I'm throwing them in my ambulance. It means I'm going to come and help you make a good decision. Okay? Fair enough? Other things is if you get a cut and it's separating, like let's say you can't necessarily see fatty tissue, but when you push it together, it spreads open again like a smile. Push your lips together. If they can stay together, it's probably something that butterflies are going to do it. But if every time you let go, that cut pulls apart, that's probably something that's going to get some glue. Okay? So those are kind of the big things I use is can I hold it together and do I see tissue underneath? All right, anything longer than a centimeter, we're usually looking at it's going to get something to hold it together if it's got any depth to it at all. Fair enough? You have hours to determine whether stitches are needed, I think. Depends on who you talk to, but like a 6 to 8 hour window. So don't feel like time is of the essence on this cut. You've got plenty of time to sit, control bleeding, and try to make some decisions on where you're going. Okay? I think most physicians would rather you not use that whole 8 hours up, but we don't need to run. Okay? Tourniquets, this is when we can't cover the hole and the bleeding is profuse and you're looking at them going, they are going to bleed to death if I don't control this. That is the only time we use a tourniquet, because tourniquets are life or limb. When I cut off the blood supply to a person's arm, let's say here down, and I put a tourniquet up here to cut that blood supply off, remember that you're also cutting off the waste that wants to leave the muscle and get put out through the lungs and through the blood system and through the kidneys and whatnot. If I hold all that waste in there with a tourniquet, when that tourniquet comes off, all that waste hits the heart at once and you can cause cardiac arrest. So this isn't just a fun thing that we play with. Tourniquets can be life-threatening if we use them, okay? So it's gotta be, oh crap, this kid's gonna die before an ambulance gets here, and that's when we tourniquet. And the way to do it is, I don't even know, grab whatever cloth you have laying around, maybe a belt, wrap it around the extremity above the cut, and then put a stick or something through a knot and just twist it, and that will cause a tightening until it all turns blue and blood supplies and blood stops coming from your hole. That's how tight you tight it. How tight you tight it? That's what I said. That's how tight we want to make it. Once you get that spun tight enough that bleeding stops, don't let go of your stick now, because then we're going to untwist. We got to either tie it to the leg, have somebody hold it, get some duct tape, and tape it along with the tourniquet with the leg. Like I'd want this stick one more at quarter turn so I could tie it with the leg so that it's not catching on things, but don't just let it go. Does that make sense? There's no real science to tourniquets. Get something on there tight, and the only thing that's going to get it tight enough is that twisting. So make sure we get that part. Just wrapping a belt around and cinching it, you're never going to get a good tourniquet. You may slow things, but you're not going to stop it. Okay? We need to twist that belt. Good? If I'm wearing a belt right now, if I were to want to make a tourniquet, I wouldn't go to my belt. I'd take my shirt off and tie that knot. I'm going to be able to twist that up better than a leather belt. Okay? Write down what time the tourniquet went on, because the physicians are going to want to know how long have I been cutting off blood supply to this arm. Gives them an idea how fast they need to move. Okay? Questions about tourniquets? Guys, I've used 2 in 25 years. It is not a common thing, so don't expect like, oh, I really need to learn the tourniquet. That's a real rarity, but since you've got big saws downstairs, we spend a little bit of time with it. Most first aid classes, I say, don't do it, you're not going to need it, but since that's why we're here, there you go. Good enough? Shock, we kind of talked about. Shock is that pale, cool diaphoretic. Shock is when the body tissue is not getting oxygenated blood. Yes, ma'am?
A question about the tourniquet.
Yep.
How far above the bleeding should it
That's a lovely question. And I would honestly say I want to be close enough to it that I'm not losing more tissue than necessary, but I want to be far enough away that physicians and whatnot are going to be able to see it and deal with it. So if I got a big cut right here, I'd love to keep joint. I'd love to be below the joint, but if you think that's too close to the cut, then we'll go right above the joint. But if we're looking at losing limbs or anything, any joint they can keep is going to be awesome when it comes to prosthetics and stuff. So I want to be in that section if I can, but far enough away that they can work and see. Okay? I'd want to be at least that far away from the cut, probably. Okay?
How far away? Sorry.
Like that. Like if I have a cut on the arm, I want to be right there or right above elbow. Okay. All right, shock we kind of already said. That pale, cool, sweaty, that's always a bad sign. That always means systems are shutting down. It is the first step to death. When we get pale, cool, and sweaty, systems shutting down, you have true life threats, 911. I'd rather get here and say, oh, they just vagal, than be here late and have somebody's kidneys shut down because we waited too long. Okay? Lay them down, keep them warm if you want, but honestly, if you're calling 911, I should be here long before you figure out where all the blankets and everything are. Internal bleeding, I wouldn't see this as a big concern for you guys with what you're dealing with down there, but just understand that somebody can bleed in their gut or in their chest, bleed to death without you ever seeing a spot of blood. So let's say a saw kicks back and they catch a 2x4 to the chest, and you see bruising like that, that's got to be evaluated. Any good bruises on the core, we need to make sure that bruise is from the skin and not from the lung or from the gallbladder or something else that's bleeding internally slowly, especially if they get pale, cool, and sweaty with that hit to the core. And thought about a wood shop and I thought about internal bleeding, and your most likely chance you'd see this is somebody kick back on the saw, standing in the wrong place, trying to slide it through a table saw, and it kicks back and gets them in the gut. We can do some serious damage with that, so we should probably be evaluated with a good kickback that's showing bruising, or pale cool sweating. Good? And I didn't see a table saw down there, did I? Just chop saws?
No.
Good. Table saws
Okay,
are
left a
nasty,
long time
nasty
ago.
bastards.
That was an unwanted guest.
I believe this guy is post CPR. That's what their chests look like after we do CPR, because we break up a bunch of cartilage and excuse me, what did I just do? We break cartilage and ribs when we do CPR, so that's the kind of bruising we can see. Things cut off. Sounds nasty, sounds terrible. It's pretty easy. Cover the hole, plug it tight, and then take the finger if you can find it, put it in a sterile gauze, maybe moist sterile gauze, put it in a baggie, and on ice is ideal. Don't let the tissue touch ice directly, because blood is not flowing through, keeping it warm. It will kill the tissue very fast. So we don't want ice directly on the tissue. We want the bag with it wrapped up, then floating on ice water. And honestly, you cut a finger off, I should be here way before you figure all that out. I'm coming on amputations. Give me a call on that one. And if you can get it wrapped in something sterile, fabulous. But I'm going to come with all that ready to go. So don't be like, we got to wrap this up before the ambulance gets here. They'll think we didn't do a good job. No, 95, the vast majority of amputations I go on, they're like, there it is. And that is just fine. We'll take care of it from there. Okay? Don't let the dog get it, and we'll all be good. We don't always put things back on the way people think, but we like to give the doctor the choice. Impaled object, this is certainly a possibility down there. I saw a nail gun down there. They can have all sorts of, kids are amazing what they can find to do. If they get something stuck into them, leave it stuck in there, okay? Don't ever remove an impaled object. The only one we ever remove is from a cheek, and we won't even get into that. Just leave it be. It's plugging the hole for you. If it's bleeding around it, you can put pressure around that screwdriver, but don't pull it out to plug the hole. It's already plugging the hole for you. Fair enough? Okay? I think I have eyes in here coming up, but same thing with the eye. Don't pull anything out of the eye. Yes, ma'am?
Somewhat separate question. Would it be better to have a stationary phone downstairs versus relying on somebody's cell phone to be able to tell you where, any location?
We do love stationary phones because we can usually pull an address as soon as you call.
Right.
So I will say I do love that. But cell phones are pretty good too. And if you've got a classroom full of kids, somebody knows the address and is going to be able to tell us
Most
where we're
people
going.
won't know the address.
Well,
Is the thing. They'll say it's at mine.
yeah.
In a building. On the edge of
If you know the
campus.
name of the building, hopefully your fire department is familiar with all your buildings. Your guys that work in this area should usually be in this area. But it is a very valid point that a landline will give me a for sure address. Usually on a campus, we can have all our buildings tied together, and so one address comes up from like the admin building or something, because that's where the bill goes. So that's a possibility too. So I can't tell you for sure it's a better idea. I can say it's a good idea. Am I saying you should go invest $5,000 to put a landline down there? I wouldn't go that far.
Well,
But
I think there's a landline down there, but you don't have a phone.
it's worth putting a $5 phone in, but I wouldn't rewire anything from the central hub to do so.
Gotcha.
Fair enough?
Thanks.
Good.
I don't know about this building, but individual buildings come up on Google Maps if you search. So, I don't know if that's an indicator of anything, but.
I am trying to think if the name of your building came up when I put the address in or not. I don't recall, but it's a possibility. We're pretty good at figuring out where you are in a situation with this where you're going to have a lot of bodies around and you're not out in the. When we have trouble getting to people is when they're like, I was hiking on the Flatirons. I was on the third one from the left. I can see the sun over this bump and those. But here we're going to get here pretty quick. A great thing to do if you have the manpower, and if you're dealing with something serious, like if somebody cut their finger and you run out to the street jumping up and down, and we're smiling when we pull up, it's because we're laughing at you. But if you have somebody that's unconscious or cut an arm off or something, give me a jumper, because if you can get me in there even a minute quicker, because I see you versus looking for little numbers on buildings, definitely send a student out there to jump up and down and get our attention, and that way I'm not looking for building numbers, I'm looking for a person jumping up and down, okay? But with the little cuts, the I'm not sures, the things like I sprained my ankle, we'll get there. Time is not of the essence on that one. But if you got something that's scaring you, and you have the person power, the manpower, the whatever you want to call it, send me somebody out to flag me down, okay? Once I get eye contact with you and I see you and I wave, you can stop jumping up and down. Because again, then I'm just laughing at you if you're still jumping while I pull up to you. Fair enough? All right, remember, leave it in. Don't pull anything out. Nails, anything like that, leave them impaled. I have seen a couple of impressive nail gun to heads where the nail's still sitting there. You're not going to want to leave that alone. You leave that alone, okay? Just leave it sticking out. Oh, before I put this next slide on, if anybody gets woozy at the sight of nasty things, this is a real picture and it's fairly gnarly, so if you want to look away you can, but this is an example of impaled objects coming up now. This shows you how important it is to not remove impaled objects. We will cut the fence off all the way around her and bring the fence with us. We do not pull things out of impaled body parts. Okay? This is not my patient, but I had this exact same call through the gut. Somebody downtown decided they were done with life and took a dive out and they landed over a wrought iron fence, and we just took the whole fence with them. And that's why I had to use that picture, because I've run that call and we do not take it out. Nothing exciting there. There's your, that's fake, don't worry. There's your nail gun to the eye. If you have eye injuries, this is unlikely going to happen to you, but what is very likely to happen down there is sawdust or metal shavings or something in the eye. You have an eye wash station. Squirt into the eye, hold it open, very uncomfortable. If that thing is too powerful, which that's a pretty powerful spray we learned this morning, just back off of it a little bit. I'm not looking to power wash the thing out. I'm looking to rinse it out, okay? And you have 2 power washers down there side by side. If I have something in this eye and they're going up to the power washer, please don't get in like this, because if I rinse it from this eye, I can rinse it into the good eye. So make sure you keep the dirty eye downhill, if you will, down gravity, especially if we're rinsing chemicals out of the eye, because the chemical will be, if I got a piece of sawdust, I'm not so worried that it's going to magically get into the other eye, but if I'm rinsing chemicals, certainly a good chance that we're rinsing them downhill into the other eye, so make sure you keep the good eye uphill, okay? With eye injuries, if you cannot get that foreign body sensation relieved, then cover both eyes and give them a ride to get it taken out. Why both eyes?
Because you're looking around with the other
If
open
the
eye.
good eye is uncovered, anywhere it looks, the bad eye with the nail sticking out of it is moving all over too. I want the eyes not moving at all. Hold them still. Has anybody ever had a corneal abrasion? It sucks. It's on the top of the suck scale. So if you can't get that foreign body feeling out, I will tell you in my last year, it's embarrassing, but it is what it is. I got a metal shaving in my eye because I did not have my eye protection on. It was just one quick cut. And I figured I could get it out, and I thought I had gotten it out and that I was just feeling a scratch, so I just dealt with it. And like 5 days later, once my eye was all red and swollen shut, I was like, all right, I'll go in. And the eye doctor pulled out a chunk of metal and said, you're dumb. And I think that's exactly the word she used. And on top of the fact that I still had it in there, it had rusted with the 5 days that I left it sitting in there. So then they take a little Dremel tool and they grind your cornea away to get the rust out. And that's uncomfortable. If anybody ever wants something fun, that's not it. So I can tell you from personal experience, if you're not sure it's out, cover both eyes and go to an eye doctor and get it pulled. Okay. Scratched corneas are lame. Open abdominal injury is not likely in your world, but should somebody get a slice across the belly, sterile becomes a little more important here than a cut on the arm. Try to get some sterile bandaging over it and never push anything back in. Okay, leave whatever's out, get all the kids away, and obviously a 911 quickly. But if you can cover it up with something moist and sterile, that's perfect. If not, hold them still, leave them still, and call it good. Okay? Even a wet shirt over guts sticking out would be better than nothing at all, because that moisture will kind of keep the tissue alive. There? There. Head, neck, back injury. Your world, again, things getting thrown and kicked back from the bandsaw or something. Your belt sander could give you a good kickback if something could fly off of that. Everybody wants to know, well, how do I need to know if I have to go to the hospital or not? Or how do I know if it's a concussion or not? And I don't get to give you that magic answer. I can tell you, where is it? There's some very common signs of head injury. Somebody gets clocked with a 2x4. These are some signs that at least concussion has happened and possibly worse. Well, how do I know if it's concussion versus bleed? I don't get to know. So every person that bonks their head and calls 911, I end up telling them, you got to go in because I can't risk my license saying, you're probably okay. So we need to encourage you, anybody exhibiting these signs after a bonk on the head should probably be evaluated. Okay? If I'm dealing with somebody's kid that's showing signs of head injury, legally I'd probably call 911 on that and put it on somebody medically trained to make those calls. If it's your kid and he wrecks his bike and he's acting a little goofy afterwards, I will be honest with you, off the record, I don't do much for a head injury except take him to the hospital. So if your kid bonks his head, gets knocked out, wakes up, and he's seeing stars, you can call me or take him to a hospital because that's what I'm going to do. Okay? We don't have a lot of treatment for your minor head injuries except evaluating further in a facility. Okie doke. All right. If somebody seizes from a bonk to the head, that's a 911, absolutely. Move things away from them. Actually, seizures are a fairly common thing, so it's not in our first aid thing, but I want to hit it real quick. If you ever see a student seizing, very simple things like epilepsy can make people seize, running a fever too fast, too hot can make a little baby seize. However, head injuries, bleeds in the head, strokes can also cause seizure too. So until proven otherwise, any seizure has to be considered a life threat. We want to get them to a safe place to seize, which is usually going to be the ground. Move things away so that they can't knock things over onto them while they seize. Do not put anything in their mouth. They may bite their tongue, yes, but that's okay. Don't try to pry their teeth open. And then lastly, when you get them to the ground and they're on that dirty ground down there and they're like, oh, they're getting their clothes dirty. Don't worry about their clothes, but I do not want their head bouncing on concrete, so put something underneath the head to keep it from hitting the floor. Okay, even on a floor like this, I'd want something under that head so that they're not giving themselves a head injury on top of the seizure. Okay, and I always just use my hands because I always have them with me. So put a couple hands under the head and let them bounce on you or your puffy coat or whatever you have that's not going to cause further damage. Okay? Yes, sir.
So if you have a student for whom you've received a letter from Disability Services and they are it's known that they're prone to seizures and they have one in your classroom, you should still call 911.
Well, let me tell you what to do with that. Most people, just to be blunt, freak out at seeing a seizure. So if you got a situation that feels like it's not in control, you can call me up. If you then hand me a letter that says, I seize all the time, don't take me to a hospital, I'm going to hang out with them a little bit till they wake up and then I'm going to not take them to a hospital. Okay? If you're cool, calm, collected, the kid's seizing and you're like, it's all right, he does this, we're all good, and you can sit there and watch it and wait for him to wake up, that's cool. If he's got that letter that says, only call if I seize for 5 minutes or longer, or only call if I have 2 seizures in a row. That's usually what those letters will read like. They'll give you a just in case. They don't say, never call. They'll say, if I stop seizing within 5 minutes, give me 10 minutes to wake up before you call. Because if I come and they're in a postictal phase, it's the phase after a seizure. If anybody's ever seen a seizure, people wake up just snowed. They don't know what's going on. They don't know where they are. They don't know they have seizures. And if I get here during that postictal phase and your friend is snowed and I don't know his history, I got to take him because he's not competent to refuse me during that postictal time. But if you hand me the letter that says, I'm John, I seize, please don't take me, I'm going to sit around with that kid a little bit longer so I don't put him through that ER experience. Does that answer your question?
Yes, it does.
To be honest with you, I show up all the time and somebody hands me a letter that says, don't call 911, and you're like, I know I wasn't supposed to, but that sucked. I totally get it. So if you feel like you're like, I don't like this, you can call us up on that. I'll take the letter and go the right direction from there.
Now, the one thing is, for you guys, you don't see those letters, and so you won't know that, and so we'll just go ahead and make the call. Because it's not happening during class time, and you wouldn't know who it is. And there's probably 5 to 10 students per semester that have those letters.
Epilepsy is a dime a dozen. It's scary to see, but all seizing stops. That's what they say in our business. All seizing stops, all bleeding stops. Don't drop a baby. Everything else is okay. So yeah, if you're comfy and you know their history, you can wait a bit. Thanks for joining us, ma'am. I'm so long-winded, huh? How are we doing on time? Okay. We good on that? When in doubt, a phone call. You feel good about it? I don't need to come right away if you've got that letter. But remember, those letters will almost always say, if this happens, then do call. Because just because I have seizures doesn't mean I couldn't also have a stroke and have a seizure from a different reason. Okay, so if it's atypical, then we would come in. That's a head injury right there. We want to call on anything that bonks up like that. Spinal injuries, big falls from their height or greater. Somebody's on a ladder trying to reach a bin down there or something. Ladder goes out. What we call mechanism when it comes to spinal injuries is if they fall from their height or greater and don't catch themselves with hands or legs, that hit to the core from their height or greater is enough to cause spinal injury. So if you see a kid and the ladder goes out and they go to ground and land on their back, I should evaluate that period. Whether they want to jump up and say I'm fine or not. If it's a student, I'm saying hold still, dude, let's get you checked out real quick. Okay, because the spine has such tiny little bones, you can break a piece of that off without it having any nerve innervation, so they won't feel pain from it. But then when that little bone chip hits the spinal column, then we have big issue. So big falls where they don't catch themselves with hands or feet, we probably want to clear that. Anybody that gets knocked out from a head injury, that's enough hit to the head that we could cause spinal damage up in the neck as well. So anybody that gets knocked out, we should see it. Okay? Question about head or neck injuries. It's very gray because it's the most litigious area of our job is the head and the neck because the vast majority of them aren't hurt. But if I play vast majority for the 25 years of my career, sooner or later I'm going to get burned because it can be enough to cause damage. All right? Dislocations, sprains, strains, bye-bye, thanks. We'll send you the tape. Sprains, strains, dislocations, basically what I say with these is if you have things going in a new direction, then don't return them to the direction you think they should be in. Leave it where it is. Cover it up if it's grossing people out so they don't vagal out, and call me up. Never return an arm to where it should be. That's an obvious dislocated shoulder right there. I don't know if anybody's ever seen a shoulder, but if you ever see how one side is round and the other side is just up, that's out. So you got a student dislocates or they're playing out here and they come running to here because it's the closest building. If they're handling the pain, I'm not doing anything for this except trying to give them a more comfortable ride to the hospital. So if this is somebody that's handling the pain well, I don't need to come on dislocations or sprains. But I will. I'm happy to come and help us make the right decision. But if we're handling pain okay, I don't come on that stuff. If you have things going in new directions, like they have a new elbow in the middle of their arm, absolutely call me on those. Fair enough? Ice, elevation, rest, compression on sprains and strains. Sprains and strains, time is not of the essence. So if somebody sprains their ankle and sits through the rest of class, okay. I don't know that my kids would do that, but if they're not excited to run up to their doctor right away, they really don't need to. But again, the new angles is me now. Fair enough, but I twisted my ankle and it's swollen. Get you to your doctor eventually, please. Okay? This would be a bad thing. That'd be a phone call to 911. That up there also falls under bad thing.
Oh, yeah.
This is a dislocated patella right here. I don't know if you can see that little bump right on top, but his kneecap has popped off to the side. Super easy fix for us, super cool. We're not supposed to fix them, but sometimes they accidentally go back into where they're supposed to go. But with dislocations, the knee in particular is super painful. Just call us on that one. You're not going to be able to bounce them into their car. A shoulder, a lot of the times we'll see kids go, just give me a ride, I'll be fine. But knees aren't going anywhere. They're just screaming until we get there. Fair? So you can go and call us right up on a knee. Besides their kneecap being either on the inside or outside of their knee, when that kneecap slides over, all those tendons and ligaments pop like this, so they'll be stuck in a position like this. So that's another sign that you've definitely got a knee out if they can't straighten it. Cool. I don't know what's wrong with the monkey, but walk it off, man. Walk it off. That's what I did to my daughter when she broke her ankle or her wrist for a week, and then I felt really bad when it really was broken.
That's what my dad did to me when I was 10. He's probably just bruised, he's broken.
I got ran over by a car and didn't get to a hospital, so we did things different back then.
We did.
As far as splinting, let's say a kid slips on the water in front of the sink down in the shop and catches themselves with their arms, and now we have a swollen, painful wrist. Again, not much I'm doing for that, but an expensive ride. Then people are like, well, how do I splint it up? There's your splint right there. Lay it on a blanket, a pillow, a puffy coat, something that they can support it and call it good. I don't like to see a lot of tying cardboard up and twisting it around and all that stuff. If you're out in the woods hunting and help is days away, fine, make any splint you want to make. But if you're going to help right away or help is coming right away, there's your splint right there. I can get ice onto it easily because it's not all wrapped up, and they can put it where it's most comfortable for them. And that's really why we splint, is comfort. So if they can put it where it's best, I'm done. Okay? Bernie burns. Thermal burns, if we touch something hot, we want to get it to cold water as quick as possible. Okay? Cold water is the answer for burns. You have burn creams down in your thing. We don't recommend them. We don't like to see them. I won't tell you to throw them away or anything like that, but I will tell you this presentation is based on a national curriculum, and when they go to the burn section, they go to the burn physicians and say, what's best for us to teach the world? And the burn physicians, the specialists, do not want you putting burn creams on. They want cold water, and that's it. They don't want aloe. They don't want any of that.
And no ice, right?
No ice, because if you burn the tissue, we've killed the nerve endings, so we don't feel that cold, so we may put the ice on too long and cause further damage, and they don't feel that it's been on there too long. Okay? Just cold water. Keep rinsing it like a long time. And keep in mind that if I touch the tip of the hot glue gun and I pull my hand off, the tissue is still being damaged. Get it quickly to cold to release this, to diminish the size of the burn. Okay? Because that tissue keeps burning until we get it stopped, and that's cold water. Okay? We'll talk about your glue guns a little bit more in a minute here. Is this a 911 call? You're tough, woman. Yeah, call me on that one. Yeah, that hurts. I'm going to get that guy stoned to the bejesus.
Let's rub some dirt on it.
Burns hurt. That's an impressive burn. That's probably, if he's handling the pain, honestly, I'm going to do two things for a burn like that. Is I'm going to control their pain, and I mean it when I say I'm going to get them high as a kite, because that hurts. And the other thing I'm going to do is make sure I get them to the right facility, which is actually University Hospital. Swedish is now a burn center too, so I guess from here probably Swedish. But that's a big thing, is taking them to the right facility too. So feel free to call me in on this one at a minimum for advice, and make sure we get them to the right place. Okay? Circumferential burns are more serious because it cuts off circulation to the extremity. So any circumferential, like the whole hand, I want to come on that. Most serious places to get burn: necks, hands, feet, genitalia, and face. Those are all more important, more leaning towards 911 on those places, because if I burn any of those areas, that stuff can be life-changing. If I get a third-degree burn on my arm and I end up with a big ugly scar, I never got anything in my life on my looks, trust me. So that big ugly scar is not changing my life. But if I burn third degree on my palm of my hand and I can't start an IV now life has changed. So we want to be a little more serious with these ones. How are we burning our genitalia? It's a trick question because you're working at a college.
Cooking and boiling water on our laps?
Pouring, boiling things in the lap. Hot coffee is probably the most common one. And the burned genitalia I've seen on college campuses is lighting their farts. Oh, yeah.
What?
See, I don't get to bring that up very often, but since I'm on a college campus, I get to say, yes, I have seen it. They tend to not call for help, but I've seen it. There's your cold water. When in doubt, call me. If you're not sure if this burn is serious enough for me, remember that slide early on. If you're out of your comfort level, that's where I should be here. So if you're looking at a burn going, I don't know, maybe call me. Okay? Here, hot glue burns, special just for you. Get that cold water, keep it on. Don't try to pull the glue off right away, because that can pull the skin off with it. I want the glue, if it's still on the skin, under the cold water as well. Get jewelry off quickly, and then if you still have glue on after that rinse, if it doesn't fall off with the cold water, this is from the internet. I just kind of researched a little bit and saw this a lot, so I don't stand by it, but I saw it a lot. So olive oil, coconut oil, something like that, that'll soften the glue and help to get it off the skin. Okay? Did that disclaimer make sense? That's a Google Net thing, not an official first aid thing. My show didn't really address hot glue. I've never seen one where the glue was still on there. It usually hardens and comes off pretty quick. Okay? If we have blisters, don't pop them, and then beyond that, getting the glue off, standard burn care. Cold water, keep it clean, and decide whether this is a big enough burn that we need to be seen. Okay? Anything that's charring skin, I should see them. Anything that is a major body surface area, trying to light the gas grill and trying to light it and trying to light it and trying to light it, and the whole time I've got the propane going or the gas going, and I keep trying, and when it finally takes and blows up the whole top part of the body, any major body surface burn, don't cold water those ones. Just leave them alone. Any guesses why?
Lower body temperature?
You're on it. The skin is your thermostat. So if you break the thermostat and then dump cold water all over them, they're fighting their burn and they're fighting hypothermia now at the same time. So if they've got enough body surface area burn that they can't control their own temperature, now we just leave them as is. It's going to hurt. I'm going to get them so high they'll forget that you didn't help them, and it'll all be good. But please don't douse people in cold water that are broken skin thermostat broken, like major areas. Body surface, upper half of the body, both legs, let's call it more than 20%. You're going to sit there and do the math. Don't pop blisters, loose things, no burn creams. I don't like natural remedies. A lot of people want to put mustard on them or butter their burns, and it's a lot of cultural ideas of how to deal with this. Our national stance is no on any of your foods that you want to put on your burns. They can cause infection. As far as your antiseptics, like I said, your burn cream, our national stance is no. If you go to a physician and he's like, okay, you need to apply this every day, do what the doctor says, because that's probably an antibacterial or something to keep it from getting infected. But as far as what can you do right now, cold water, that's it. Okie doke. Is that 911? If it's
Borderline?
what's that?
Borderline?
If it's my kid, I'm probably giving him a ride to the hospital, but I'm me. If it's a student who is in your care, I would probably lean towards overdoing it, which is me. And then we'll help make the right decision from there. Serious? Not serious?
That looks serious.
Junior pulled the hot water down on him. That is a very serious burn. The red around it shows me that everywhere that's pink is missing skin. So this is that one that I'm not putting water on. That's major body surgery. Sunburn. Don't do that. Electrical burns will hit really quick. You do have a few little electrical things down there, but not a ton. If you get hit by the big dogs, the 220s, I was working behind my oven or my dryer, that's where the big ones are residentially. If you get hit by those, I really have to have the stance of be seen. As far as your 110s and more of what you have down there, actually your big saws, they're probably 110, or are they?
110.
I'm guessing they're 110, yeah. Chop saws should be 110. Anything of that electrical amount that can be enough to stop the heart if it hits you right in the cycle just right. However, if it does, it's going to drop you right now. So if I get zipped by 110 and I pull off and I'm like, that sucked, you're basically done and we all get to laugh at you. But if you hit the ground from 110, that's 911. That means it hit you at a bad cycle in the heart, okay? 220 or greater, that can cause damage without us knowing it. So people that get knocked to the ground from that, if you get that big of a jolt that you're knocked to the ground, I want to see them. If you get knocked out, I want to see you. If you get hit by wires above a house, I want to see you. I have a couple times in my career, and keeping in mind I'm one guy, multiply me by how many paramedics out there. I've had two guys that hit wires, got knocked to the ground, said that sucked, and got up and went to bed and woke up dead the next morning because they had damaged so much to their heart, but they didn't know it. So from having seen it, once is enough for me. I've seen it twice. So I tell people, you get that big of a hit, be seen, please, even if you feel like you're okay. You see entry wounds from electricity, be seen. And if you get burns from electrical, that's probably a good sign that's enough electricity that you should be seen. Okay? Treatment-wise, if they drop dead, it's CPR. If they're still alive, being seen is about all I can tell you. Okay? Questions about electrical burns? But again, sorry, go ahead.
And when you say being seen, does that mean drive to the urgent care or call 911?
I honestly would prefer a 911 call because if we did burn the heart, I can't tell how much or when, but I have an EKG machine that can help me to
And diagnose
determine
that
that.
right away.
Okay, I'm not going to come out, put an EKG on you and say you're cool. Well, it's all good, but I can help to rule it out. Fair enough. We still need blood gases, or not blood gases, but some blood tests and stuff to see if there's damage to the heart. Okie doke. But yeah, your guys that get a little hit, let's say there was a power cord that got rubbed wrong or ran across the blade or something, I've seen that one, and they get a little zip from that. I'm not real worried about those as long as they don't get knocked out.
Or the burn, entry burn.
If you see the burn, now it's a different one. Okay? Chewing on a cord, bad plan. There's your entry wound that this guy I want to go in. Okay? Chemical burns. If it is a wet chemical, rinse, 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 and then when you're like, I cannot possibly rinse any longer, double that. Dry chemicals do not rinse. When we add water, we make new chemicals. So if you have a dry chemical, we just want to brush that off the best we can and call poison control or read the label. If the label on a dry chemical, a powder, says rinse with copious amounts of water, listen to the people that made the chemical over me. But if you don't know what you're dealing with, don't add water until you know it's the right thing. Okay? Chemical burns to hand, something like that, I'm going to give them a ride because I don't know what all the chemicals are, so I'm going to say, yeah, you should go in. But I'm not doing much for this unless it's maybe pain control. So if you want to take them somewhere, I'm okay with that one most of the time. Okay? There's that jet stream. Do I have anything else in here that I didn't see? Downhill, wash it to the downhill eye. This is a good number to have if you're working around chemicals much. I didn't see much down there, but I don't know what other things you guys teach or anything. If you're around chemicals a lot, poison control is a good number to have. Bloody noses, I don't even know why I left this in there, but pinch, pinch, pinch. Nothing up here, no cold packs here, just a good solid pinch for 10 minutes. Don't look every 2 minutes. If any of you have kids or are going to have kids, don't look every 2 minutes. Don't let them do it themselves because they'll keep looking every 2 minutes and that lets the clot go. Give me 10 solid minutes. Check for clotting. If it hasn't clotted, give me 10 more, just like this, solid minutes. And if it hasn't stopped within 20 minutes, that's a posterior bleed further back in, and they'll pack it. They put a little baby tampon in there, basically, to hold the pressure back in further, or sometimes they'll cauterize it. But if you can't stop it with 20 minutes of pressure, then you can probably take them in to be seen. Okay? Last thing is that Grandma used to have you put your head back like this when you got your bloody nose. Please don't do that. She was just having it run all into your stomach, which can give you an upset stomach and make you vomit it up. Never put their head back when they're bleeding. We always actually want them forward so it'll run out their mouth. Okay? Oh, there she is. Injured teeth. Adult teeth can be put back in if the whole tooth gets knocked out. Touch it by the part that's usually exposed. Don't touch the root if you can avoid it. And then we put it into, because we all have Hank's balanced salt solution, whatever that is. Saline, like contact saline, egg whites, coconut water, or getting to your more realistic milk, Gatorade, or their own spit. She knocks a tooth out. I'm going to get a clean cup and have her spit in it enough to cover the tooth. Throw her tooth in her own spit and say, go to a dentist. Okay? And we can sometimes pop them back in. We used to say pop it back in the hole and go to the dentist. Now we don't ask people to do that anymore.
And are there 24-hour dentists?
If you are an after-hour situation, you go to an ER and they'll get somebody on call.
Okay.
That gets pretty expensive, but it is your tooth, and teeth are nice to have. So. Okay, no questions about teeth? Kitty teeth, they're not going back in. I took my 6-year-old to the dentist. She cried so much they couldn't do the work, so now I get to pay to get her anesthesia for a stupid cavity. All right, splinters, certainly I would think you could see these down there. Something we all want to do is grab it with tweezers, but oftentimes when you grab a splinter with a tweezer, depending on what kind of wood and how much it is, part of the splinter can stay in there when we grab out. So I'd actually rather pick at it to remove it that way instead of trying to pull it back out the hole. Because pulling back out the hole, we have a better chance of splintering it off versus just picking at the skin until I have a good long line to pull it out. This is not an advertisement by any means. I don't get any money here. I just can tell you that I have these at the house and they're awesome. They're just a good design to pick things out, throw them away. They're always there. They're always sterile. When I was making this, I was like, oh, I'm out of those, and I bought 2 more packs. I think I can now take out 40 splinters for $6 or something I paid. So again,
Just little needles,
not
basically?
well, it's a flat piece of like almost metal, but it comes to a really sharp tip. So because it's flat, you can get a better grip on it. And again, it's always sterile, so I don't got to worry about that. And I always know right where it is because not one tiny little needle that I'm trying to find in the first aid kit. It's a box, CA big. Again, it's by no means necessary, by no means at all, but it is handy and they work pretty cool. Dun, dun, dun. Okay, so how did we? That was a little over an hour. We said hour to hour and a half, right? Anything you want to talk about that I didn't talk about besides the CPR? I'll give you that chance in a second. But first aid wise, anything that you've seen or students you know have problems that you want to talk about? I was asked to adjust the trauma stuff, so that's what I focused on here. But if there's any first aid topics you want to talk, like I said, we did seizures, low blood sugars are a common thing we can see. I don't know. You want any more?
Anything of interest?
No.
No. Has it been pretty boring while you've been supervising?
Yeah,
just
but
opened all the-
that's
It's
good.
perfect. We like boring. Yeah. Okay. Okay. Excellent. Okay, that's good.
Anything? Cool. Fair enough. Then I will say thank you for your time. I will pull a dummy out if anybody wants to do hands-only CPR. It would take me, honestly, about 5 minutes to teach you the basics of CPR.
That'd be great.
Sure.
Okay.
Yeah.
If anybody wants to roll, I'm done. Good, thank you very much. And otherwise, here I go to CPR. Is anybody CPR certified? Ever been CPR certified?
Taking classes,
There.
that's different.
All right. How do we know somebody needs CPR then? Anybody can give a pop at this. How do you think we determine it's time to push on someone's chest?
They're not
No
breathing.
pulse.
I got not breathing and I got no pulse. Fabulous answers. One other thing we look for, and actually the first thing we look for, is unconscious. Okay? Anybody that is unconscious, I need to check to see if they're breathing. So that's the first thing, is if somebody is asking you to stop doing CPR on them, they're right, go ahead and listen to them. We are doing CPR on unconscious, unresponsive people. So if I walk into, let's call it the bathroom, and there's someone on the ground, first thing I'm going to do is, hey, are you okay, are you okay? And if they don't answer me, people have different levels of unconsciousness. So from voice, I'll then go to pain, try to hurt them to see if you can wake them up. We use a good solid sternal rub. Nobody does this hard enough. I'm talking dig in. I put pretty much all my weight into it when I do a sternal rub. We really want to see if we can wake them. Another quick and easy trick that's less aggressive looking is you can take a pen across a nail bed, and if you put a slight pressure right there, you feel it or no?
Yeah.
Right at the base of the nail bed where the little half moon is, if you push a pen on there, that tends to hurt a lot for 90% of people. I have had students that are like, I don't feel a thing. But for me, if I just push like that, I get a zinger. There's a nerve right in there that most people have that can be a good painful stimuli real quick, and it doesn't look like you're trying to hurt them. So, unconsciousness is the first thing. So if I have somebody unconscious and I try to wake them up and they do not wake, what things do you think I need to do now?
You're to call 911.
911, thank you. That's the biggest thing, is whether I'm going to do CPR next or not, this is still a medical emergency. Unconscious is always going to be a medical emergency, so we're going to call 911 if we can't wake them up. Now, while that phone call is being made, I'm going to determine how much of a problem I have, and the way I do that is by watching the chest to see if it goes up and down. Okay? I am merely watching for breathing. We don't do a pulse check anymore. Everybody messed it up. We were wrong the vast majority of the time. So whoever said check their pulse, you're right, and I still check a pulse, but lay rescuers, we just say look for breathing. If they're not breathing, they're about to lose their pulse anyway if they haven't. So we skip the pulse check for y'all, make it super easy, and say watch the chest, okay? If you look at them and you see up and down and you're like, oh yeah, that's breathing, cool. If you don't see it right away, in order to be positive about CPR, I ask you to naked the chest. I want to be looking at flesh, and if you're looking at skin, I promise you 100% of the time, you will know whether they are breathing or not. If you try to look through her puffy coat, I can't give you any promises of what you're going to see. If you try to look through a light t-shirt with very shallow breathing, this shirt can hide shallow breathing. But once you're looking at skin, I've tested this on well, she's 6 now, but when she was 3, she would know every time whether CPR was necessary or not, because I'd squeeze a little bag and the chest would go up or down, and I would let a little air out the side so the chest didn't go up or down, and my 3-year-old could figure it out, and she's got my genes. She ain't so smart. If she can figure it out, y'all can be sure whether a person is breathing or not, okay? Don't let your brain mess with you. It's the #1 thing we see when CPR is not happening. It's because people weren't sure if they were breathing or not. And it just, as an instructor of this stuff, annoys the crap, can I say crap? Annoys the crap out of me, because there should be no reason to not know. Look at the chest, get down on their level, and watch for rise and fall. Just watch for rise and fall. I'm looking for a pattern, and you don't need to look for any longer than 10 seconds. Within 10 seconds, you should see if there's some up and downs, okay? If you don't see it, don't go, I'm not sure, start CPR, because you will be sure. My 3-year-old is sure. You need rise and fall within 10 seconds. When people die as they shut down, sometimes they'll take what's called an agonal breath. It's big, it's ugly, and it's loud, and they go, and it's like their whole body. If they do that, and they're like, oh, I think they're breathing, and you watch for longer, and there's no pattern, that is what I call a death breath. It's an agonal breath. I'm going to do CPR on somebody that doesn't have a pattern. Every once in a while, that's dead. I need a pattern of rise and fall. Within 10 seconds, you should see a couple breaths. Okay? Fair enough? When in doubt, push on the chest. I'm not going to teach you the breathing part now. We're just going to do hands only because it works. When somebody dies of cardiac arrest, you have residual air left in your lungs. So just pushing on the chest will circulate that air for 6 to 7 minutes of CPR. So in a cardiac arrest, feel free to just push on the chest. If you have a respiratory death, that air is gone. But again, now we're getting into a whole CPR class. But a respiratory death is like asthmatic, choking, drowning. That person used their residual air up. That's why they're on the ground. But if you die because your heart stopped, your balloons are still full. So we can just push on the chest, okay? And even if it is a respiratory death, it's better to circulate non-oxygenated blood than not to circulate it at all. So even if you're like, well, he choked, so he's out of air, so why would I even push on his chest? Circulating blood without air is better than not circulating at all. So you do what's called hands-only CPR, which is what I'll show you right now, okay? We clear on when we need it, no up and down, check for 10 seconds, naked chest, okay? Get them to a hard, flat, sorry about your camera, but you're about to lose me. CPR has to be done on a hard, flat surface, so if it's around the school, they likely fell to the ground. That's where we find them, so that's perfect. If grandma's visiting for Thanksgiving and you go in and check on her in the morning and she wakes up dead, we need to get her out of the bed, because on a bed is not an effective place to do CPR. The mattress will just bounce up and down for you, okay? So get them to a hard, flat surface, usually the floor, and then I'm going to kneel beside them. I've already got the chest naked, right? Because that's how I could tell that they weren't breathing. 911 is called. If you're on campus, please find the closest AED. They are around, and they are very necessary right now. So send someone looking for an AED, and then I'm going to start pushing. I find nipple line or armpit level on a normal male adult is about the same. It's the lower half of the sternum, which is the bone that all the ribs come into. I need to be below this. I need to be above the xiphoid. So right below nipple line is about where I'm going to be. I use the meat of my hand, interlock my fingers, get above them like this. And then what most people do wrong, because we watch TV, is we sit here and do this thing with our arms. There is no arm strength involved in CPR at all. It's all weight. Okay, I need to rotate at my hips to get the chest to compress. Okie doke, arms are locked. Normal male adult, this guy drops, it's going to take 125 to 150 pounds of pressure to get his chest pushed. So, you're the wrong person. Get that guy and say, hey man, can you push? We need the weight on this. It's not a sexist thing, but we need on a normal male adult size. Okay? We're all going to get you done easily. Ladies, you're going to be cake. But if you get a young male student who's got any build to him at all, it's going to take somebody with some weight to get a good compression. Okie doke. I interlock fingers, lock the elbows, and rotate at the hips. And then that doll is designed to make a little click to make us all feel good about ourselves. This is CPR on about a 13-year-old girl or a 100-year-old woman. This is not hard enough. okay? It's a poorly designed doll for an adult. If you get a male student drop, and you want to feel that 125, 150 pounds of pressure, try to do this on my doll. She's not designed for this, so you have to move your hand up a little bit more. Only on the doll, not real people. Does that make sense? Because we're going to do a little experiment here. If you want to feel real CPR on one of us guys that's not 100 years old, try to get this doll to do this. And there's real CPR, and now I'm working. The elbows are locked, it's all hips. Red? That's real CPR, okay? The depth that you are trying to push is at least 2 inches on adults. I tell people try for half the depth of their chest. So if she's here, I try to get her to there. You are unlikely on a normal male adult to get them half the way to the ground, but if you're just thinking that way, you're more likely to get the 2 inches, okay? What else? How fast? Anybody ever heard how fast to do CPR? The news does stories sometimes. It's at least 100 per minute, and if you can't remember numbers well, the song Staying Alive, that's right at 100 a minute. So if you want to sing in your head, that's the tempo you're going at. If you're more of a realist, Another One Bites the Dust is also 100 per minute, but don't sing that out loud. It's bad. You're looking for that tempo, though, and the heart wants tempo, so keep it smooth and even while you're going.
And you crack ribs, that's better than...
To be honest with you, and I mentioned on that slide, that is how you know you're going deep enough, is you will hear something gross, and you'll be like, ugh. And then you hear Dennis going, yes! And then you get back on it. Efficient CPR on a post-pubescent person will break ribs or pop cartilage, okay? So your first few pops, you should hear a crack that makes you go, and get back on it, because that's what I want, okay?
And that's more beneficial than,
Death? Yeah.
but the CPR is actually working, it's doing something.
What we do is I am trying to squeeze the heart between the sternum and their backbone, their vertebrae. So in order to squeeze that, I got to close that whole chest cavity. And the way I close that is by smushing halfway down. If I do a good chest compression, I move about 25 to 35% of their normal blood volume. So your heart beats right now, all the blood goes out. I do CPR on you, a third of the blood goes out. So that's why I want people pushing too hard and faster than normal. Our hearts right now are probably going around 60 to 80, most of us. I want you pushing faster than 100 because I'm not moving as much blood with each compression. That's why I want to go faster. Okay? And this wears you out on an adult within 2 minutes. So we want to switch out other people as quickly as we can. And you're in a classroom and either you're not big enough or you're the only one that knows it, get one of your students and be like, I'm going to have you do this in a minute here. So see what I'm doing? My elbows are locked. See where my hands are? Okay, I'm tired. Come in and have them ready to go. We want the transfer from one person to another to be smooth. So if I'm pushing away, I'm going to be like, Levi, man, I'm done here in a minute. Will you get on the other side of me and you get ready? And when I count to 10, you're in. And then 8, 9, 10. And he's all ready to go and knows it's coming so we can keep the rhythm going. The heart wants the rhythm. Okay?
Someone, if a very large guy needs it and you only have extremely small people or only girls available who don't have enough weight themselves, can 2 people do it, or is it just not going to happen?
Not going to be realistic. My answer to that is sometimes people die. It's not an ideal situation. I have situations where I'll go to push on the chest, and this is going to come as a surprise to some of you, but I am not the biggest guy. I have times when I'll go to push down on a large person, and instead of them going down, I go up. It's like, okay, I don't know, I don't weigh enough. I've got a guy on my crew that's 6'7" and weighs a ton, and he pats me on the head, and he's like, you are such a cute little bastard, and he moves me out of the way, and then he gets it done. But if I'm not the right person for the job, whether I teach this every week, every day, I live this stuff, I'm not always the right person. So get somebody that has the weight to get it done. And if you got to teach somebody really quick how to push on the chest, man, it's not rocket science. Okay?
Is there something we could do that would be more damaging than...
No.
Okay. Because if they're not breathing, then it's this or... Okay, got it.
And people are like, well, what if I was wrong and they didn't need it?
Yeah.
Worst case scenario, you break a rib. And we're protected by something called the Good Samaritan Act on that. Nobody's going to sue you for breaking the rib, not successfully. Okay? There's never been a successful lay rescuer CPR case in the United States. Okay? They'll come after my butt now and again, professionals, but lay rescuers, Good Sam is this huge, nice blanket that says, leave them alone, they were trying to help. Okay? And what we find more often than not is the people that did CPR when it wasn't needed didn't pay attention in class, so they also don't push deep enough, so we tend to not even see broken ribs on the ones that didn't need CPR in the first place. It's very rare for me to see somebody that didn't need CPR and got it and has a broken rib. 'Cause
They
they
usually wake up before that.
Yeah, but the vast majority of the time, it's CPR, AED, my drugs, the right dot. We got to get a bunch of stuff put together.
And if we're doing this and somebody does find an AED, should we go ahead and use that? if
Yeah,
cameras are
good
out there?
question. I didn't bring one with me. If you can get someone to bring an AED fast, you open it up and you do what it says. There's a big green on button, turn it on, and it will talk you through every step. Absolutely firefighter proof. Idiots can do it. You can figure it out. There's stickers, you put them on, you push until the stickers are on, and then as soon as you put the stickers on, the machine will say stop CPR, checking for VFib, which is what we want to shock, and then it'll say VFib detected, charging, and it charges, and it says press the red button, it's flashing, you press the red flashing button, and they bounce, because they are getting a big jolt of electricity, and then you get right back on CPR, and the machine tells you every step. When they designed it for a typical American education. Guesses? Anyone guessing guesses? 3rd grade it was designed for, and then they gave it to groups of 3rd graders, and they used it successfully 100% of the time in the trials with no training at all. They said, here's a dead body, here's a red box. The red box could save them, and these kids were like, open the box! And from there, they got it done. Okay, so yes, we definitely need an AED. We need it fast. We've got 10 minutes to use it. Every minute that goes by, we lose a 10% chance of it working. So we want to be fast with the AED if you got one nearby. If anybody wants to push on the chest, go right ahead. Give it a feel.
Yeah, let's,
And I'm done.
thank you, Dennis. We're gonna go at it?
Sure.
Yeah, we should all do it while we're here.
There's a little knee pad in the middle of that red bag if you want to use it.
Just hit about right there.
Yep, just below nipple line on a normal male adult.
You just keep your arms straight like
Yep,
that.
locked in. That's perfect. That's it, man.
Sweet. I remember doing that once before, like years ago, but I
Just
forgot
keep
about
going.
it.
You just keep going. And remember, you're going to get tired. So if there's someone standing around,
Say
at
you're
2
on deck
minutes,
next.
Yeah. And you're going to be fine. You're young. You're fit. You're going to feel like, this is good. I got it. We did tests on us. And at 2 minutes, we thought we were perfect. Our efficiency bombed. So
yeah.
you want to switch out at 2 minutes even if you're feeling good.
You're right, I can't get it to clunk.
The AED is right at the front door, but as soon as you open the door, the fire alarm goes off, so don't.
Oh, okay.
But it's out there, the EH&S department. checks
Go for right here.
their
Yeah.
bases.
Go, put it right there.
Yeah, but I was trying to do it, make
Oh,
it clunk
so-
like
Well,
you
you're
were.
not going to. So get a good rhythm on that. Let it come all the way up in
That I
between.
don't
Yeah,
know.
those
It
are
says
great.
call 911.
Don't bounce off the chest. We want our hands to stay on, but we want the chest to come all the way back up between each compression, lets the heart reach.
Yeah, okay, got it, cool.
I'd rather have a good rhythm, pushing as hard as you can, than bouncing. And, just get a good rhythm as hard as you can, but don't be like, okay, I gotta get harder on this one, and I'm tired, and we don't want that all over the place.
Yeah, okay, cool, got it. Next.
Little bit faster. Those are good. A little bit faster. Little too much. That's good. Jenny likey.
Do you have to maintain contact the whole
I
time?
do want you to maintain contact. If you start
So you
pulling
don't
your
wanna-
hands off,
you don't wanna
we get
remove your
back
hand from
position.
contact,
We want to
okay.
stay on the whole time.
Okay.
But do let the chest come up between each compression.
Okay.